Serum Institute of India CEO Adar Poonawalla has allayed fears concerning COVID vaccine, Covishield. After reports have surfaced of blood clotting following inoculation, Adar Poonawalla said the data on clotting is going to only come by next week and only scientific data will ascertain whether the clots resulted from the vaccine or not. Moreover, he has hailed Covishield's efficacy and said that COVID vaccination is going to prevent hospitalization. Poonawalla also clarified that Covishield is not a bulletproof vest and that an individual taking both the doses of the vaccine has protection for 7 to 8 months.
The Ministry of Health in India, the WHO, the EMEA and other countries have said that this vaccine is perfectly safe. Certainly here, the quantum of blood clots that have happened, we have to still establish and see if it's vaccine related based on the fact that, blood clots is a normal phenomena in a given population of age and comorbidities. So the vaccine is providing excellent safety and efficacy. So we're seeing that 90 plus, 94% plus efficacy with even one dose of Covishield in India. No vaccine, whether it's Pfizer, Moderna, Oxford, AstraZeneca, is preventing more than 20-30% of the people who get it or are exposed to COVID-19 from getting the disease. They experience mild to moderate disease. So there is no vaccine, sadly, on the planet today for COVID-19 that prevents the person getting the disease. So far, what I can say with confidence is I have not seen anyone getting the UK variant disease who has been vaccinated and still ending up in hospital. So far, that is the silver lining. But to conclude this beyond reasonable doubt, we should wait at least another month or two till we see enough people getting the UK variant as a disease who have been vaccinated and then observing how severe the disease